Hello, welcome to the Voice of the Nightingale podcast. In this episode, we are going to talk about the 7 signs of oral cancer that everybody should be aware of. Listen, cancer can happen to anyone, whether it's through genetics or whether it is through some of the practices that we do that we aren't really aware of. So in today's episode, we're going to talk about the 7 signs of oral cancer that everybody should be aware of. You can have a plan. You can say, I'll be this, I'll be that. You can have all the money in the world. You can have a very good plan, structure of your life, how you see your life. And then suddenly you are hit by the news that, oh, you have a cancer. And it changes your life completely. It changes the way you see the world, the way you see life, the way you interpret purpose. Everything changes. So that's why it's very important to talk about your health, because your health is your wealth, and your health is your future. Your health is your survival on this earth. Even though we are going to die, it is rather important to be knowledgeable. Before we should proceed, let's talk about what is oral cancer. Now, what is oral cancer? Oral cancer is a cancer of the mouth or the oral cavity, your mouth. Basically, it can be cancer of the lip, your tongue, your gum, your cheek, the palate of your mouth. It can happen in any of your mouth area or your oral cavity. Oral cancer is a subtype of the head and neck cancer. So, what is cancer? Cancer is a disease of the cell. It is when the cells of our body is not functioning like the way it's supposed to be. You see, cells are supposed to grow, they're supposed to divide, and then they're supposed to die in this very timely manner. So we are very designed in a very special way, our cells to grow, divide, and die. But when that does not happen, when that cells does not respond in a timely fashion, when the cells started to dysfunction and started to grow uncontrollably, they move around and invade other organs and move around the system. That results in cancer and eventually death. So cancer is very dangerous, as we know. Cancer does not have a cure. You can treat it, but it also depends on the early intervention. So in oral cancer now, the challenges is that oral cancer is always detected late, because sometimes it's very hard to tell in the mouth. It comes as of painless, and the bump is not really that big, and you think that, oh, now I'm good. But then it quickly turned malignant, or it started, it's already at stage 4. So even though according to global study exists that the survival rate is 50%, in countries like Papua New Guinea and other developing nations, the survival rate is actually less than 20%, because most of the time the patient that comes because of the late intervention or late detection and late diagnosis, most of the patient normally really can't be saved because of that factor. So it's a challenge. So most important thing is for people to be aware of the signs that we are trying to discuss and how to prevent it. Yeah, that will be the solution. Now, the moment you're diagnosed with cancer, you will no longer have the same function like you used to be. You will no longer see the light the way you were seeing. You will no longer do the things that you used to do, talk, eat. It completely changes your life, from your psychological to your physical, from the functioning. Everything about you changes, and you will no longer be the same person. So it's really important to have this sort of conversation so that you can detect if you have cancer, or if you think that you have cancer, you can detect it very early. That's why it's very important to have this sort of conversation about health. Okay. So for example, when you're diagnosed with oral cancer, even though you get a successful treatment, it can be okay. But sometimes if the surgery or the other treatment is successful, you lose some of the function of your mouth. For example, if you have a cancer on your tongue, you can no longer speak because they're going to remove part of your tongue. Or you're not unable to say the words, not eat properly. Sometimes they fiddle with you. You no longer have the same face that you were, no longer can smile. And it completely changes psychology. Everything about your life can change in a minute. That's why it's very important to have this sort of conversation so that you can know, because you can detect the signs early. If you're a chewer, if you're a smoker, if you're a chewer of it or not, if you're a smoker, if you drink alcohol, and if you're exposed to any of this one of the causes, then I think this is very important for you to know so that you know what to do You know how to prevent it. You know how to screen yourself with oral cancer. You know what to do, where to go. So this topic is very important. Let's talk about what we have been waiting for. The 7 signs, the 7 warning signs of mouth cancer. The 7 warning signs of mouth cancer that everybody should be aware of includes, the first one is persistent mouth sore. A mouth sore in any of your cavity, whether it's in your tongue, your cheek, your gum, the roof of your mouth, the floor of your mouth, wherever in the mouth. If you have sore, like ulcer-like sore, or any sore that has not gone for more than even 7 days or more than 14 days, even though you treat it with antibiotics, you took antibiotics for 2 weeks, and if the sore still does not heal, it calls for concern. It could be an oral pathology, or it could be a sign of cancer. So what do you do? Bring yourself to the doctors, go to the dental clinic, so that the doctors there can see what is really wrong with you, and they can give you a proper examination and investigation. That's number one. Is this person. Number two is red patches in the mouth. Now, your normal oral lining or your oral mucosa in the mouth is pink, but if you notice a very dark red like signs or dots in your mouth, please, okay, I am telling you this. Check your mouth once in a while or once every 2 weeks with mirror. This is the thing, most people don't really look inside their mouth. They just brush their teeth and they go. It's very important to check, okay? Check for those red patches like we call it erythroplakia. These red signs or red patches in your mouth. You look for them. If you notice the red patches around your mouth, it's concerning, and you should definitely go see your doctor in the dental clinic. The third one is white patches in your mouth. We call it leukoplakia. Now, there are some people that neglect their oral health, so you'll notice all this plaque building up and all these white patches around their mouth, their gum, their tongue, because of the poor oral hygiene and poor oral health. But even though you're brushing your teeth after that and you're scraping up all those patches off, whatever, and if it's not going and if you still notice those white patches, it could be other oral health pathology or sign of a cancer that calls for concern. So I think you should go to the dental clinic, seek doctor's advice. That's number 3. Number 4, now check for any thickening, lumps, any bumps around your mouth or around your jaw, on your neck, wherever. If you notice that you have a swelling or bump or strong thickening, thickness around your mouth, even though it's not painful, even though there is no sore, it's really important. If you see this, go quickly to the dental clinic. Do not delay. Go see your doctors, and they will further do the investigation and tell you the result why you have those bumps, lumps, and thickening around your oral mucosa. Number 5 is if you're experiencing persistent pain, numbness. Number 5 is if you're experiencing persistent pain, numbness, and thickness around your mouth. For example, if you feel like your tongue is numb and you no longer feel any sensation, or your cheek is numb, your jaw is numb, you can no longer feel pain, anything, it feels really numb, then it calls for concern as well. Do not delay, go see the doctors. Alright, number 6 is difficulty chewing, swallowing food. If you're having difficulty swallowing food, chewing, or if you feel like something is stuck in your mouth and it's been there for a while, it calls for concern. It can be really normal. If you feel that your jaw is not moving like it is, a difficulty in your mouth, or you speak, the way you're eating, if there's changes in there, definitely run to the clinic. Go see the doctors so that they can do further investigations. Number 7, if you're losing your tooth, if your tooth is coming out without any reason, or if you normally wear false teeth or dentures, we call it, and if it's loose and if it's not fitting properly and it is becoming all of a sudden, that calls for a concern, right? If you don't have any gum disease, anything, and if it's just coming out, it could be because there's a cancer developing under your jaw. So it's really important to go see doctors in the clinic. Alright, so those are the 7 important signs. Thank you for staying with me, and thank you for learning about oral cancer. The 7 signs of oral cancer, do not forget. It's very important to detect it early. On the next episode, I am going to talk about how to do screening, how yourself you can check oral cancer screening. I'm gonna teach you on that for the next episode. I'm very sorry, I have been busy because of my residency. I don't have time to film, or I'm just this project is my passion. I've always wanted to do this. That's why I'm doing. But I'm at a time where my residency is coming to an end, and I'm doing my last block, and I don't have a lot of time to really sit down and talk more and do a lot of videos and editing, and all this takes a lot of time. Apart from me doing all the residential requirements, this YouTubing is also taking a lot of my time. So bear with me. I will be going little by little. If you're expecting quick, give me a time, at least a week. So I'll be posting at least one episode per week. So keep an update, keep an eye. My goal, the Voice of the Nightingale podcast, is to talk all things health, from your mental health to physical health to social health to spiritual health. And there is a information gap in the global health sector. So our goal is to bridge that gap by providing the right information. We believe in the power of information. I personally believe in the power of information. I believe informed people do the right decisions, and I believe informed society makes a great nation. So this podcast, this channel is to talk all things health, to bridge that information, to give you the evidence-based, well-researched information to you so that you can get the information to do the right decisions, so that you can prevent diseases, so that you can help yourself and help your family to live a better and healthier life. So my goal is to get a community of 1,000 people at the end, before the ending of 2025, before 2026 starts. I want to have people that wants to learn about health, want to have a conversation about health, want to get to talk about their mental health, why things happen, ask questions. That's sort of a very interactive community. 1,000 people would be really well. And thank you to the 67 people who have subscribed to my channel, who is also a part of this community that we're trying to build. And my goal is to have those 1,000 people who will be consistently watching, talking, commenting before 2026, and to make this channel bigger. So yeah, thank you for your patience. Our next episode will be on how the prevention, the more discussion on oral cancer, because it's a huge topic, how to do screening, how to prevent it, all of that. So keep your eyes up. Once again, thank you for joining the Voice of the Nightingale. I'm your host, Mazel, and good night wherever you are. Thank you.